The last concept in this sort of busting sleep myths is it disordered sleep or a sleep disorder? So what I'm really getting at by that is if you think of the sleep system, and we'll talk about some of the biological, physiological systems that underpin sleep, but if you think about that as a sleep system, is the sleep system actually working okay? And it's just on the input side, there are things that are inputs to that sleep system that are producing a predictable output. And the output isn't what you want, but it's a function of the inputs. Or in fact, is it a problem with the system itself? Is there a disorder of sleep that means the inputs are appropriate, but because sleep is disordered, it's not producing the expected outputs? Because really disordered sleep, where it's a problem on the input side, is far more common than sleep disorders per se, a problem with the sleep system. Again, the example of the patient I saw this morning, marked hyperarousal, very strong sympathetic nervous system activation or monoaminergic activation, whichever sort of synonym you want to use to describe that. On the input side, there's very strong waking drive. So on the output side, you'd expect sleep to be late and short and vivid dreams and night sweats and characterized by motor restlessness. So the problem's not with fixed sleep, the problem's change the input side. This is the type of thing we see in clinic all the time. You guys who work in mental health will be very familiar with this sort of presentation. Cameron, 30-year-old living at home with mum, irregular sleep, often not getting to bed till 2 to 3 in the morning, sleeping until the afternoon, tired in the day, and during the day, most of the days in his room playing video games. So Cameron did a sleep diary. This is a 2-week visual sleep diary. In reality, I'm sure his mum filled this out rather than Cameron himself doing it. But I really like these visual sleep diaries. They're a really nice behavioural experiment for both patients and carers as well. Because actually, if sleep looks like it's a mess, it's chaotic, it's all over the place, I just can't predict what's going on, once you actually start to map it out, there are patterns. And in this particular pattern, yes, there's late sleep, but there's also a bit of what we call drift. So the timing of sleep just gets later and later each day, and then it's stable for a bit, and then it just gets later and later. So that's really a body clock that's longer than 24 hours. And that's very consistent with both hyperarousal, will lengthen that, but also someone who's effectively retreated to their cave. There's no engagement with the outside world, playing video games in a darkened room. And so their body clock's not getting that recalibration of outdoor sunlight, where you're going to be up at the same time every 24 hours. You're just going to drift and have this drift. Now, just to complicate things, Cameron's got comorbid depression, ADHD, ASD, on lisdexamfetamine, citalopram in the morning, quetiapine and industrial dose melatonin at night. Mother's desperate, trying to get him up at the same time each day. For various reasons, that's always sabotaged by Cameron, who just refuses to get up and pulls the cover over himself. Cameron's an NDIS client, so mum had read a nice study from the University of Colorado, where a researcher took adolescents with sleep problems into the woods for a week with no electronics and no internet, and their sleep patterns all normalized after having had phase delay in the urban environment with electricity. Problem is, when they went back to the urban environment, they all went back to their phase delay. And then Cameron didn't even get that far, because when things didn't go his way, he had enough and left after being away camping for only a bit of a day. Now, one way of thinking of this as a sleep system, if you think of it with that approach of inputs, is a problem with the inputs or the system? This was a very simple prompt that I put into GPT-4 last year with this particular brief version of this particular clinical presentation, and saying, predict what the sleep would be. And it gives you that sort of breakdown of how those different comorbidities and medications are going to impact on sleep. And even an unfiltered sort of GPT prompt will tell you sleep's actually a function of what else is going on. There's other things. This isn't a sleep problem per se, and the desire to make sleep normal, despite GPT numbered 8 different things impacting on sleep, it's a bit of an unrealistic desire.